welcome to Well Within Reach. And my name is Dr. Neva White. I'm the Executive Director of Frazier Family Coalition. And today we have a treat, an absolute treat. We have our neurology team from Jefferson here, some of the best and brightest, as I would like to say. And we're just going to have a conversation. Primarily, we're going to be talking about telehealth. It may be a different concept for a lot of people. So we're hoping that at the end of this, that folks will have a better understanding of the opportunities that are available and choose to engage in this type of care. So I'm going to start out by introducing our guests. And then we have a few questions that we want to ask. There may be some things that the guests want to ask each other. And then I'm going to turn it over to Dr. Mattel after I introduce her, and everybody can go around and just say a little something about themselves if there's something you want to say in addition to the introduction that I have. So I'm going to start with Dr. Shapey Mattel. And for a lot of you that know her, if you're at Jefferson, she's the head of tele-stroke and tele-neurology. And we are just so glad to have her here with us today. She's also a clinical associate professor at Thomas Jefferson University. We have Dr. Lori Sheehan, who is also at the she's actually the division chief for general neurology. And so we're going to have a lot of conversation for her. And then we have Dr. Anusha Dor, and she's going to be talking about sleep medicine, neurology, and tele-neurology and tele-stroke. Okay, so doctors, if we could just go around really quickly and you guys could tell us a little something about yourselves or anything that you want the audience, the community that's listening in to know about. Dr. Mattel, we could start with you.
Sure. Thank you, Neva, so much. So I am the division chief for the tele-neurology and tele-stroke program, as Dr. Neva White mentioned. And I also lead the innovative program with Jefferson as we have developed a newly started neurology hybrid transition care clinic. And I would like to elaborate more later as we discuss about how can we use, virtual care in today's modern medicine.
Thank you so much.
Should I go next?
Sure, that'd be great.
I'm Dr. Lori Sheehan, and yes, I'm the chief of the division of general neurology, and so I do predominantly my work now is with the tele-neurology group, and we're doing inpatient consults at some of our smaller hospitals that don't have the typical in-house neurologist, and so it's very rewarding work because we know that group of patients and those doctors that are trying to help those patients really appreciate having us as a resource. And then my other hat is in outpatient neurology. And so there I'm seeing a lot of people with cognitive impairment, and I'm seeing a lot of people with headaches and other various neurologic symptoms and diseases. But I think, cognitive concerns and headaches are probably the most that I see. And I use a combination of both in-person office visits and telehealth visits in that role as well. So doing a lot of telehealth, working in this beautiful office that you see at my home, and really, I think enjoying helping people in different ways.
Thank you for that.
And I am Anusha Idara. I have newly joined Tele-Neuro about a year ago for our tele-neurology team. That's primarily what I do in seeing consults throughout our remote sites. Prior to this, I was doing mainly outpatient neurology. I am sleep trained, and I did work with our own small sleep clinic at my previous site.
All right, well, let's just delve right on in. Dr. Sheehan, I wanted to talk a little bit about, have you seen any expansion or growth in access to care through telehealth? And can you kind of tell us a little bit about that, especially with patients who have headaches, memory disorders, seizures? How has really telehealth expanded their access to care?
I would say that the biggest thing that I see is for the folks that have transportation issues, and having that option to be able to see me in the office, but not have to leave their home has been huge. I mean, for folks suffering with cognitive impairment, and really for their loved ones, their family members or caregivers, sometimes it can be very difficult to get them out of the house and into the office, and so to be able to work together remotely is so important. And I think a lot of cases, those patients and those families, they skipped those appointments in the past. They just didn't come because it was too difficult. And the value, maybe, you have to weigh, like, what's the value of going to this appointment versus the trouble that it's going to cause in trying to get there. And so I think a lot of times those appointments were skipped, and now they don't have to be skipped. And on top of that, the value is probably also improved because I can evaluate people in their homes and what are some of the difficulties in the home. And I can kind of see them in their most comfortable place and how things are. It's not always an accurate snapshot when somebody comes into the office. They might be more kind of agitated from driving into Philadelphia and trying to find parking, and that kind of thing can weigh on people. And similarly, even with headaches and seizures, predominantly for my patients that are very, well controlled, I'll say, like they have headaches, they have seizures, but we have them on a treatment regimen that is controlling them. Again, they might not come to their appointments in the city because it's a hassle, but they do still need medication refills, and they do still need to touch base about things. And those telehealth appointments are really beneficial for keeping people in touch, because there may be other things that we do need to talk about, whether it be side effects of medications or just troubleshooting different things that they might not come in and discuss because, everything's going just fine. So, yeah, I think, for all of those reasons, it's really expanded that kind of access. And again, other transportation issues come up as it relates to cost or disability. And so being able to do televisits for patients that just can't get into the office for any reason is really helpful.
Oh, that really sounds good. Dr. Mattel, when we think about stroke, and we know that every minute counts, telehealth, stroke, telestroke, how have the outcomes been? Have you seen outcomes?
Absolutely, Dr. White. So one of the things that I would like to mention, that time is brain, and every minute 2 million neurons die. So that is a very important fact that we have to keep in mind when we talk about expertise care such as stroke care. And there is a big deficit between the number of neurologists and the number of patients needing stroke care. So you cannot have an expert stroke neurologist from an academic medical center located at every hospital in the community. So it is very important to keep telehealth a medium for modern medicine where we can expand these geographical boundaries and bring the expertise care from Philadelphia to other communities or from another city to rural areas throughout America. And research studies for the last 2 decades, actually, we talk about telehealth. I want to make sure that people do realize that we know COVID has been catalyst for telemedicine, but telestroke and telehealth has been in place for a couple of decades, the modern version of telehealth, so as to speak, where there is video component and the audio component to telehealth. So that has been in place for the last 2 decades, and telestroke, even with Jefferson, has been in place for over a decade, in the community. So the research has shown that patients who get telestroke care and who get regular in-person neurology care at the big hospitals, the outcomes in terms of whether it is related to their disability or related to their mortality or related to their discharge disposition, whether it is to home or rehab, is no different between telestroke and the regular inpatient neurology care. And this is the data that is not just proven by research. Even in our own personal experience at Jefferson, we see the same outcomes.
Thank you so much for that. Um, it was interesting. We had a community day here at the Frazier Family Coalition, and we brought the mobile stroke unit, and we actually had a participant who was in Bensalem. She was in the supermarket. She had a stroke in the supermarket, and she was able to utilize the mobile stroke unit. You want to say a little bit about that, Dr. I know we didn't really necessarily talk about it, but you got to say something about it because it's an extraordinary mobile unit.
I think that's one of the biggest things that has happened with telestroke is that we have not been able to just provide the care with virtual, the virtual care to the hospital itself, but we are bringing the virtual care to patients' doorstep. So mobile stroke unit is essentially an ambulance that carries a CT scanner and what we would call a doc on the box. A stroke expert on the computer screen who can actually see the CT scans and evaluate the patient literally outside their homes, where there is family available to provide us the details about what happened to these patients, what medications do they take, and then based on our assessment in the mobile stroke unit, we can make a very timely decision. My colleague here, Dr. Sheehan, actually has done these, I would say, probably the fastest home to TNK, like not the hospital door, but the home door to TNK time that I am aware of throughout the country, that I am aware of, right? So she has done the fastest TNK from home door to TNK to the TNK needle, and that was like 18 minutes. So, so this is what we are talking about. The care doesn't have to be in person. I am not undermining in person care at all. I think there is a role for both. But the scenario where these patients would otherwise have taken another hour to first get to the hospital, see an expert, get a CT scan, we literally cut that time into half. On an average, we have cut that time into half with the help of the mobile stroke unit. And I know you mentioned Ben Salem, so I would like to share with our listeners that actually we have added another mobile stroke unit in the Upper Merion area, and that will be serving Upper Merion and the nearby counties. And we look forward to serving more people with our stroke expertise.
It would be wonderful to have a few of those units in Philadelphia. I think it would really change the way we look at stroke care. So, Dr. Anusha Idara, I wanted to talk to you about sleep and sleep medicine and how has telehealth really opened up opportunities for treating people with sleep disorders?
So I think as with broadly telehealth in general, accessibility is a huge component. There are not many sleep specialists around, and there's a lot of people with sleep-related problems, whether it's sleep disorder breathing or insomnia or what have you. And I think that the visits themselves are easier and more accessible now with telehealth, but also the follow-up care, finding out how they're doing with their machines or even getting tested for sleep disorders, the home sleep testing, utilizing the machine data later on once they do get a PAP device for following up if they are, doing well on it, if there's a high leak with their mask, if they have residual AHI. You can do this all remotely now, which is great. And I think also in this follow-up portion, you can kind of track and see if families want to participate. They can also include, I noticed them snoring or I noticed them kicking in bed. You can kind of track their clinical progress, and it makes it much more, telehealth makes it more easy for them to participate. You don't have to navigate getting to the clinic, coordinate schedules for family members to come also, I think that it helps in overall care, accessibility, and compliance moving forward.
And I think I would like to raise an important point that both of my colleagues here, Dr. Idara and Dr. Sheehan, have made. There's an interesting component to seeing the patients in their home setting. They're at their most comfort, they're at their highest comfort level, so as to speak, what Dr. Sheehan mentioned. As a stroke neurologist, I'm very particular about what my patient eats and drinks, because a lot of these patients are diabetics or they're hypertensives. And it is not unusual for me to log on and see a Coke sitting right on the table, or my patient having a dessert or a meal at that time. And all of a sudden I'm looking at it and I'm like, hey, what are you eating? And, there are research studies going on with actually, the details about how we can impact, with virtual health, not just the patient, but their families around them,
Right.
right? What
Yes.
you bring to the fridge, what you bring to your, your kitchen cabinet, right? That's extremely important, because what you are eating is likelihood that the rest of the house is eating the same thing, right?
Yes.
So I think there is value to having just those small little things that you would not notice otherwise in an in-person setting. So I think that really adds value to, oh, I did not realize you were actually not following the diet instructions that we had shared with you, you know? And sometimes it's interesting how, the cats and the dogs and the kids, they run
That is a
around.
big one, at least for sleep. That is huge. Like seeing how they interact, and are they hopping into bed? Is that what's waking you up? Are they pulling at your
Mhm.
cords or your wires?
So I think it's a very different sort of a setting, where you get to know the patient and the people and their
Yeah.
social structure behind them. So I think uh, that's an important, I would say, not an ingredient, but an important aspect to the overall patient care in a way.
So I want to ask, and anybody can answer this. Let's talk a little bit about some of the new tools that are out here: the electronic medical record, the patient portal. How do you see these things enhancing virtual neurology and the care of general neurologic conditions?
I'm happy to take that one if you guys want.
Sure.
So, I mean, the electronic medical record is generally great. Of course, I think physicians all at times have their piece to speak about some of the technologies, but in general, what it allows us to do is communicate really effectively across specialties, and even across institutions at times with some of these more advanced electronic medical records. And one of my favorite tools that has just recently hit Jefferson is AI scribes. So now I can have, my phone running in the background, recording our visit, and then writing my note for me, similar to like AI minutes that a lot of people I think use in their jobs for meeting minutes. And it does a surprisingly fantastic job at capturing all of the nuances of our discussions. And in a lot of cases, I may be seeing somebody for dementia, but I'm also talking to them about their blood pressure and their diabetes and their nutrition and how much they're exercising and all of these other things that play an important role. But previously, when I was documenting my note, I was really only touching base maybe on like what we were doing specifically for the dementia. And now we're talking about all of these things, which the patients can then reference too, right? They have in their MyChart account, which is their patient portal, they have the ability to log on there and see all of this. And again, then be able to see, oh, right, we talked about nutrition and these are things we talked about 150 minutes of exercise per week. And we talked about all of these little tips and things. So it really improves the communication amongst providers, but also between the doctor and the patient and the families, and being able to communicate, to send a message and say like, hey, I know you mentioned, I should take some magnesium for my headaches, but I forget what the dosing was. And, you can send a quick message back. So just improving the communication in so many different facets is a huge benefit of some of the newer, electronic tools that we have.
I would like to add to what Dr. Sheen wonderfully
Yes.
talked about is the FaceTime value, right? When you are talking to the patient, if your focus is on writing the notes versus there's somebody else who is doing that work for you, you know. So a lot of times patients would complain, I saw the doctor spent only 5 minutes, because we have only limited number of hours in any given day, right? And we have so many patients, so like to see in a given day, right? So I think with the help of AI tools that we have now, there are a lot of things that we have added in terms of communication, the face time value that we spent with the patient, the quality of time that we spent with the patient. And with that quality of time, we have taken away the mundane activities in a way which would limit our accessibility to our patients as well. So maybe what we were like, if we were able to see 8 patients in a day, now maybe we'll be able to see 10 patients in a day. So that's 2 more patients in a day. And given the number of providers we are, you can imagine that adds to how many more number of patients overall in a given year. So I think that improves the accessibility, the FaceTime value, the communication. And I do think, there are a lot of new tools with AI and, virtually, so as to speak. Patients can record their blood pressure at home. They can actually share all those details in real time with us through the added software, which will give us an alert if there is an abnormal value too. So there is nursing charting done through EMR. Patient can be remotely monitored at their home, as we like to call it, remote patient RPM, remote patient monitoring. And then patients who have headaches or patients who have stroke, they can monitor their glucose, they can monitor their headache number of days, record those number of days, and help them keep a track of their illness or the progress of their improvement too. So I think there are a lot of AI tools, very novel AI tools, who are helping both the physician, the patients, and the overall healthcare that we are able to deliver virtually and non-virtually both.
Great. So a couple more questions, and I know we'll conclude today's podcast, but I wanted to ask Dr. Idara about, if I'm coming to you, this is my first time getting a telehealth visit. I know nothing about a telehealth visit, and I'm coming for a sleep disorder. What would you like for me as your patient to bring to this telehealth visit so that I'm prepared to get the most out of this interaction between both of us?
So I think the most important thing is valuing that time that we have allowed to interact with each other. So the most helpful thing in a sleep visit particularly, and it would vary based off of the specialty, but in a sleep visit for me, I'd like to know your sleep structure, and I'd probably have that in the pre visit questionnaires in your EHR, that my chart messaging or whatever it is. And it would be really helpful to know the essence of, or the skeleton of your sleep structure, as well as your sleep wake structure, your schedule for the day. And also what is it that you want to focus in on? What is bothering you? Is it that you're waking up too many times? Is it that you're not getting enough sleep? Is it that your spouse is complaining about how much you're snoring or kicking them at night? Whatever it is, that way we can tailor kind of the visit to focus on those problems instead of taking too much time in establishing, what that schedule would be. And so.
Okay, well, one last thing I'm going to ask everyone, if we could go around and just give us one healthy lifestyle health habit to protect our brain health. I know, Dr. Mattel, you mentioned a bunch of things, but maybe we can highlight and emphasize that one thing that you really want your patients to kind of focus in on as it relates to their brain health.
Sure, absolutely. So I know we talked about time is brain. So I would say when you or your loved one are having any symptoms of stroke, which is fast, facial droop, arm weakness, smiling difficulty, or you're having difficulty with your speech and walking, please call 911 right away. So I think that's not directly the brain health, but when you are in danger, it's important to call 911 right away and do not sit and wait at home. We know that still, given the time we have spent in educating people about stroke, 80% of the patients still show outside of their window to get the treatment that they can get in the emergency room. So it's very important to call 911 and come to the nearest emergency room as soon as possible. And the one other thing that I would add is take those 10,000 steps a day to the best of your ability. And I think just practicing good habits, no smoking, and avoiding alcohol.
Thank you so much. I'm so glad you mentioned the signs and symptoms of a stroke. That's critically important. All right, Dr. Sheehan.
Okay, so I mean, my one tip for everybody is going to be exercise, and whatever that means for you, but exercise is really the one thing that has been shown to slow down the progression of neurodegenerative conditions, things like Alzheimer's disease, Parkinson's disease. But it's overall so good for everything in your health, your cardiovascular system, and it's so important to keep your cardiovascular system healthy in order to deliver good oxygen and blood to your brain, the nutrients to your brain. So exercise, the magic number is 150 minutes per week. That is a lot of exercise. And so, again, it depends on where you're at in your life. And some people can, run marathons, and other people it's a struggle to get from the bed to a chair. And so, finding what works for you to safely get your heart rate up and break a sweat is really important. And trying to find what those roadblocks are and creatively find ways around those roadblocks. Maybe it's just carrying a gym bag everywhere you go so that you're just ready right then and there to work out. Or maybe it's doing something with your arms because your hips and knees aren't as great as they used to be. So there's always roadblocks, but talking to somebody and finding creative ways to get that exercise in 150 minutes per week is that magic number.
Thank you for that. Dr. Dora?
I guess mine would be just really try to dedicate your focus and, I guess, create the priority for your own sleep. Your sleep's not a luxury. It's not something that needs to be, flexed off or I'll catch up later. It's really important for your brain health, your body, your mood, your memory, your cardiovascular health. But oftentimes it's neglected, right? It's the first thing that we sacrifice. And I think that it's an underused preventable component of your health.
Well, thank you all again. You did not disappoint, just as I expected. I want to reserve the right to bring you all back, though, at another time, because I know we're going to get a lot of questions about what was discussed today. So I do want to reserve the right to bring you guys back. I want to thank you again for being here. Frazier Family Coalition, I'm getting mixed up here. Frazier Family Coalition for Stroke Education and Prevention. For more information about what we do here at Frazier, you can subscribe to our YouTube channel, which is Frazier Family Coalition. You can also look us up on our website, frazierfamilycoalition.org. So thank you all again. Have a wonderful rest of this week. And we appreciate so much what you do for the community, what you do for the patients, and what you do for Jefferson in general. So thank you so much.
Thanks for having us. This was fun.
Thank you so much.
All right, take care, everybody.
Thank you. Bye-bye.